Welcome to Module 7. Module 7 is about general medicine. General medicine is a broad term and encompasses many medical specialities. We will be looking at some aspects of general medicine. In this section of general medicine, we will be looking at mainly the gastrointestinal tract and the terms associated with that. We will be looking at root terms, suffixes, and lots of conditions associated with general medicine and investigations too. So let's get going. Let's look at the root terms associated with the gastrointestinal tract. Well, let's imagine you've just had your lunch and you've swallowed your first mouthful of food and it passes down your gullet, and the root term for gullet is esophag, or esophagus is the full term, but the root term is esophag. So I may have esophagitis, inflammation of my gullet. From there, the food passes from the gullet into the stomach, and the root term for stomach is gastro. I may be sent to have a gastroscopy, a visual examination of the stomach. From there, the food passes into my intestine, my small intestine, and the word for intestine as a whole is enter. So it enters your intestine. The small intestine is divided into different sections, and the first part of the small intestine is actually called the duodenum. Beyond that, it then leads into something called the jejunum, and from there the ileum, and the ileum is then connected to the colon. Col is the root word for colon. The colon has different sections to it, but the one I'm going to mention here is something called the sigmoid colon. The sigmoid colon is just beyond the rectum, and the root word for rectum is proct. Some patients may go for a sigmoidoscopy, so a visual examination of the sigmoid colon. Proct is rectum, so a patient may have proctitis, inflammation of the rectum. In yellow, we have the organ called the pancreas. The root term for pancreas is pancreat. It's very similar. A patient may have pancreatitis, inflammation of the pancreas. The pancreas is where the body makes insulin to control your blood sugar levels. Spleen is splen. So a patient may have a splenectomy, a removal of the spleen. The spleen has many functions, from storing blood to being part of the immune system. Hepat is liver, so I'm sure you've heard of hepatitis, inflammation of the liver. And the little green bit tucked underneath the liver is the gallbladder, and the root term for gallbladder is cholecyst. And your gallbladder stores bile. Bile is a substance which is used to help break down fats. So if you eat a cream cake, then your gallbladder will go into action, squirt the bile into the duodenum to aid the digestion of those fats. At the start of the colon, there's a small little bit sticking out, and that is called your appendix. And many people have an appendicectomy, though it can also be called an appendectomy. Let's make some words out of this lot. Let's start off by looking at some terms associated with the gullet. The gullet was the esophagus, and you can have various problems with the esophagus. Let's have a look at one that can occur. You can have a stricture or a stenosis, which means narrowing. So a patient may have an esophageal stricture. So that would be narrowing relating to the esophagus, the gullet. Another term is reflux. Reflux means a backward flow. A patient may have reflux esophagitis. This would be inflammation of the gullet due to a backward flow of acid from the stomach. Another very similar term is gastroesophageal reflux disease, also known as GORD. There is a term called Barrett's esophagus. Barrett's esophagus actually relates to abnormal cells in the gullet. And this can occur if a person has GORD or gastroesophageal reflux disease and it continues and it continues and it continues and it is not treated. Possibly some cells in the gullet can change, and this can be called Barrett's esophagus. Potentially, Barrett's esophagus could turn into esophageal adenocarcinoma. We can break that down. Oma is tumour, carcin is cancer, aden or adeno is gland. So I'd have a cancerous tumour of a gland relating to the esophagus. Let's remind ourselves of the root terms we covered a moment ago on the diagram. Esophag was gullet, so esophagitis, let's break it down. Itis is inflammation, so it's inflammation of the esophagus, the gullet. Gastro is stomach. A patient may have gastric atrophy. You may remember that trophy is the suffix meaning nourishment or growth, but we think about it in size. Remember, the cells got bigger. So atrophy would be no nourishment, which means that it gets smaller, so it's wasting. So gastric atrophy would be wasting of the stomach tissue. Enter is intestine. You may have enteropathy. Pathy means disease, so enteropathy is disease of the intestine. Proct is rectum. Proctalgia, let's break it down. Algia is pain, so proctalgia is a pain in the rectum. Cholecyst is gallbladder. Cholecystectomy, well, ectomy is our ending meaning removal of the gallbladder. Hepat is liver, so hepatitis. Itis is inflammation of the liver. Our next root term is a new term. Lapar means abdomen. A patient may have a laparoscopy. Let's break this down. Oscopy is a visual examination. It's a visual examination through the abdomen. And there are various investigations which use a laparoscopy. So a laparoscopy is a visual examination of the abdomen. Another new one, NCEF means brain. Encephalopathy, let's break it down. NCEF, AL, and the vowel, pathy, it means disease relating to the brain. On our next slide, we'll be looking at endoscopies. The term endoscopy means a visual examination inside. We know that oscopy is the suffix and it means a visual examination with a lighted instrument, so you can actually see what's going on when you look inside. And end is the prefix meaning inside or in. On the diagram, you can see an endoscope being passed through the mouth down to the stomach. Now this would be called a gastroscopy because it would be a visual examination of the stomach. Let's look at some terms. Endoscopy, we know how to break that down. And we know it means visual examination inside. A gastroscopy, well, oscopy is visual examination and gastra is stomach, so it's a visual examination of the stomach. And here is a picture of a gastroscope, so the instrument used to visually look at the stomach. Sigmoidoscopy, a very common type of investigation. We can break it down. Oscopy we know means visual examination. So it's a visual examination of the sigmoid colon, which is up the rectum and turn right is sort of the last bit of the colon. Here is a sigmoidoscope. It's a bit larger than the gastroscope. And next we have a big word, esophagogastroduodenoscopy, otherwise known as an OGD. How do you say this word? Well, you say the word the same way you would break it down. So let's break it down. esophago, gastro, duodenoscopy. So it's a visual examination of the duodenum, the stomach, and the esophagus, the gullet. Hence it's called an OGD. Another large term, endoscopic retrograde cholangiopancreatography, otherwise known as a ERCP. Well, endoscopic we know means looking inside. Retrograde means going the opposite way to normal. So actually in this case you're going against the flow of the fluids in the body. Cholangiopancreatography, well, we can break that down. The col bit refers to the gall. Angi, or angio, is the vessels. So that's the gall vessels. Pancreat, it's pancreas. It's nice and obvious, that one. And graphy is our X-ray or picture. So we have an X-ray of the pancreas and the gall vessels. In order to do that, they need to squirt in some dye. The dye allows the soft tissues to show up on X-ray. So an endoscopic retrograde cholangiopancreatography means a visual examination inside to inject dye into the gall vessels and pancreas to be seen on an X-ray. And lastly on this list, a laparoscopy. Well, oscopy is visual examination, and lapar we had earlier meaning abdomen. So we know that laparoscopy is a visual examination through the abdomen, otherwise known as keyhole surgery. So all the above are examples of endoscopies. They are looking inside, and you can look in just about any bit of the body with an endoscope. You can do an arthroscopy, so a visual examination of the joints. You can look at the respiratory tract, a bronchoscopy, looking at the bronchial tubes. You can look at the female reproductive organs. You can have what's called a hysteroscopy. When the doctor or nurse is performing a gastroscopy or a sigmoidoscopy or a colonoscopy, one of the things they may come across is something called a polyp. Let's look at what a polyp is. A polyp is a growth protruding from a mucous membrane. Polyps are commonly found in the colon, the stomach, the nose, the sinuses, the bladder, the uterus or womb, and the neck of the womb, the cervix. Let's have a look at a polyp. Here we have a diagram, and within the intestinal wall you have this extra little growth sticking out, and that is the polyp. A person with a polyp may have a polypectomy. Let's break it down. Ectomy means removal of a polyp. And you can see on the diagram on the left-hand side, they have a special instrument to grab hold of it and literally pull it off. A colonoscopy would therefore be, oscopy is visual examination, so it's a visual examination of the colon. Apart from polyps, a colonoscopy can also diagnose something called diverticular disease. Diverticular disease relates to pouches or ballooning of the bowel, though this ballooning can actually occur elsewhere in the body as well, particularly the bladder, but the common place is in the bowel. Many people have these small little pouches lining their colon, the large intestine, and they bulge out through weak spots in the colon. So diverticular disease is literally pouching of the bowel. It can be quite uncomfortable. Let's look at some word examples associated with diverticular disease. Our first one, diverticulitis. Let's break it down. Diverticule relates to the ballooning or the pouching, and itis is inflammation. So it literally means inflammation of the ballooning of the bowel. Another term, diverticulosis. Let's break it down. Osis means condition or disorder. Diverticule relates to the pouching or the ballooning. So therefore, if you have diverticulosis, you have a condition of ballooning of the bowel. Next, we will look at terms associated with the gallbladder. The gallbladder is part of a system known as the biliary system. And we mentioned earlier that the gallbladder stores bile, hence the biliary system. Let's have a look at our first term. Well, we know that cholecyst is gallbladder. Cholecystectomy would mean removal of the gallbladder. Ectomy meaning removal. Cholecystitis, let's break that one down. Itis means inflammation, so it's inflammation of the gallbladder. Patients may have an operation known as a laparoscopic cholecystectomy. So the laparoscope refers to the keyhole surgery, so going in through the abdomen. So they go in through the abdomen with their laparoscope to perform the removal of the gallbladder. Another term we have mentioned before is lith. Lith means stone. And a common condition is cholelithiasis. Let's break it down. Iasis means condition of or disorder. Lith is stone. Chole relates to the gall, so it's a gall stone. So it's a condition of having a gall stone. ERCP, we had this one earlier. It means endoscopic retrograde cholangiopancreatography. Let's break it down. Endoscopic means they're going to look inside. The retrograde means they're going against the flow of the fluid. Cholangiopancreatography, let's work it from the back end. An X-ray of the gall vessels and pancreas. In order to see the soft tissues on X-ray, dye has to be squirted in. The liver is closely associated with the gallbladder, but let's look at some terms associated with the liver and the spleen. Let's start with the spleen. Splen is our root word for spleen, so a patient may have a splenectomy. Ectomy means removal of, so it'd be removal of the spleen. Splenomegaly, let's break that one down. Megaly means enlarged, so splenomegaly would mean an enlarged spleen. Our next term, hepat or hepato, is liver. A patient may have hepatomegaly. Megaly means enlarged, hepat is liver, so it's an enlarged liver. How about this one, hepatosplenomegaly? Where do you think the brakes go? There we go, hepatosplenomegaly. So here we have an enlarged liver and spleen. When the doctor examines you, he's prodding around on your tummy area and he'd be able to identify if those organs are enlarged. If, however, they are not enlarged, he might use this abbreviated form with a little circle up in the air like a degree, which means no, and use the term organomegaly, saying there is no enlarged organs. Organ is organ, megaly is enlarged. Our little symbol at the front means no, so you put it all together, it means no enlarged organs. So there's no organomegaly. Great word. In relation to the biliary system, the substance bilirubin. Bilirubin is an orange pigment. Bilirubin is the substance found in red blood cells. After about 12 weeks, a red blood cell has lived its life, and off it goes to the spleen where any good bits are recycled. And one of the pieces of the red blood cell that's recycled is a substance called bilirubin. So the spleen removes the bilirubin from the red blood cells and sends it off into the blood where it gets carted off to the liver. The liver then processes the bilirubin and it gets turned into bile. And bile is then stored in the gallbladder. Let's have a look at a word. Hyperbilirubinemia. Let's break it down. Emia is our blood condition. Bilirubin relates to this orange pigment, and hyper means excess or too much. So it literally means excess bilirubin in the blood or a blood condition of excess bilirubin, however you like to say it. If I have too much bilirubin in my blood, and this bilirubin is an orange pigment, well, I'm going to look quite orangey coloured. And there is a term for this. It's called jaundice. Jaundice actually means yellow. So if you have hyperbilirubinemia, excess amounts of bilirubin in your blood, you will be jaundiced. You will look yellow. It's time for In Your Head. This time we have some terms for you to look at. I want you to study the terms on the left-hand side. Just think about them and see if you can work out their meaning and match them up with the terms on the right-hand side. It's just a thinking exercise. You don't need to press any buttons. It just gives you a moment to think about things. So, off you go. Time for me to press my magic button, so let's look at the first one. Let's start with reflux. We had the example of reflux esophagitis, which would be a backward flow of acid up the esophagus. So reflux means a backward flow. Retrograde means opposite to normal. We had the big term ERCP, meaning endoscopic retrograde cholangiopancreatography. And we're squirting some dye against the normal flow of the bile in order to look at the biliary system. Polyp is a protruding growth. You can have nasal polyps, polyps in your bowel, cervical polyps, the little protruding growths out of the membrane lining various organs. A septum is a dividing wall. You have your nasal septum, and you have a septum in your heart dividing the left side and the right side. Effusion is the term for fluid. Lith is a stone. Cyst is a sac or bladder, and we've had the term cholecyst relating to the gallbladder, which is a bladder holding bile. Stenosis, narrowing, and sclerosis, hardening. Next, we'll be looking at terms associated with diabetes. Diabetes is a problem where patients are unable to control their blood sugar levels. So let's look at some diabetic terms. Our first one, glyce, is the root term for sugar. Hypoglycemia. Let's break it down. Hypoglycemia. Emia is a blood condition, glyce we know is sugar, and hypo means reduced or low amounts. Think O for low. So hypoglycemia therefore means reduced sugar in the blood, or a blood condition of reduced sugar. If a patient has hypoglycemia, they may feel a bit woozy, not quite with it. Another thing that can happen with diabetes is the complete opposite. Hyperglycemia. Let's break it down. Hyper, break, glyce, break, emia. So we have a blood condition of excess sugar. Hyper being the excess or too much. So we have excess sugar in the blood. The organ that creates insulin is the pancreas. And insulin is a substance which allows the body to regulate the sugar levels. In diabetes, the insulin being made is either inadequate and not managing to control the blood sugar levels, or not enough is being made. Here's the term pancreatography. Graphy is an X-ray or recording, pancreat is pancreas, so this would mean an X-ray of the pancreas. You can see on the diagram the yellow pancreas where the insulin is made. Let's look at the term diabetes mellitus first of all. DM is the abbreviation. Diabetes is a disease caused by deficiency or diminished effectiveness of the hormone insulin, which is made by the pancreas. Type 1 diabetes mellitus results from the body's failure to produce sufficient insulin. Patients with type 1 diabetes will be on insulin from the outset of the discovery of their disease. A very common type of diabetes is known as type 2 diabetes mellitus, and this is a result of the body's resistance to insulin produced by the pancreas. A patient with type 2 diabetes can be treated by regulating their diet, by taking oral hypoglycemic medicines, which help reduce the intake of the sugar. But in severe cases of type 2 diabetes, patients may be on insulin injections. Previously, type 1 and type 2 diabetics were referred to as IDIMS or NIDIMS, insulin-dependent diabetes mellitus, or NIDIMS, non-insulin-dependent diabetes mellitus. These two terms are being replaced by the terms type 1 diabetes and type 2 diabetes. It's now time for some more suffixes. Let's look at some suffixes. So emesis means vomit and hemat is blood, so therefore hematemesis means vomiting blood. Emia is our suffix for blood condition. Hyperkalemia. Emia, blood condition, Al relating to, K, potassium, and hyper means excess or too much. So you have a blood condition of excess potassium. Oma means our tumour, or a mass or a swelling. A hematoma would be a swelling containing blood. Let's have a look at this example, an adenocarcinoma of the colon. Well, oma in this case means a tumour, as in a mass and a lump. Carcin relates to cancer. An aden, or adeno, is a root term meaning gland. So we can read this word from the back end, and it says tumour, cancerous gland. So a better way to put it would be a cancerous tumour of a gland. You find glands all over the body, so consequently, with cancer, it is possible to have an adenocarcinoma wherever there is a gland. Our next suffix is plasia or plasm, meaning formation or growth. Our example, dysplasia of a polyp. So dys is our prefix meaning difficult or disordered. So dysplasia would mean a disordered formation or disordered growth of a polyp. One of the concerns associated with dysplasia of a polyp, for example, is that cells that are showing dysplasia have the potential to change further and possibly become cancerous. Our next term, if you remember this one, is phagia, meaning swallowing. So dysphagia would be difficulty swallowing. If I have esophageal stricture or esophageal stenosis, so narrowing of my gullet, I'm going to find it hard to swallow. Let's look in more detail at this term, adenocarcinoma of the colon. Adeno is gland, carcin is cancer, and oma means tumour. So you can have the term adenocarcinoma of any gland in the body. An adenocarcinoma, let's break it down. Aden, O, carcin, O, oma. And it means a cancerous tumour of a gland. On this diagram, you can see the bowel. Towards the bottom of the bowel, in the sigmoid colon, there's a little mark saying there is a cancer developing there. And this is a common place for bowel cancers to occur. Another term for cancer of the bowel would be colorectal cancer. We can break that down. Col relates to the colon, rect, the rectum, al relating to. So it's cancer relating to the rectum and the colon. The term malignant, you may have heard of this, a malignant tumour, would be a dangerous or invasive tumour, so invasive cancer. But the term malignant actually means dangerous. So you might possibly hear the term malignant hypertension relating to dangerously high blood pressure. Benign, or a benign polyp, would mean a harmless polyp. Benign meaning harmless, or not invasive. Dysplasia of a polyp. We had the term plasia before, meaning formation or growth, so that would be disordered growth of a polyp. If a polyp was removed during a colonoscopy, it would then go off to be examined, and the results may come back to say it is a benign polyp, there's no problems. Neoplasm or neoplasia means new growth, new formation. So the term neoplasm or neoplasia is associated with cancer. In relation to cancers, say for example an adenocarcinoma of the colon, part of the bowel may be removed, and in which case a stoma would be needed. Let's have a look at some words associated with stomas and ostomy. The term stoma and the suffix ostomy refer to an opening. Let's look at this in more detail. A surgeon creates a small opening in the abdomen, called a stoma, and attaches part of the intestine to it. Waste travels through the intestine and exits the body through the stoma. A patient would wear a pouch over the opening to collect the waste products, and the patient would empty the pouch accordingly. Here is a little drawing of what a stoma may look like on the skin surface. Let's look at some word examples. A colostomy, let's break it down. Ostomy, if we think S for that staying open, so it's creating the opening into the colon. Ileostomy. Ile relates to the ileum, which is the last part of the small intestine. So ileostomy would be making an opening into the ileum. Proctocolectomy. Let's break it down. Proct, o, col, break, ectomy. Ectomy we know is removal, col is colon, and proct is the rectum. So it's removal of the colon and the rectum. If this is the case, a patient will require a method of getting rid of their waste products. So consequently, they would require an ileostomy. This could be a temporary solution, or further operations down the line can fix the ileum to the anus. A gastrostomy would therefore be an opening into the stomach. Some more ostomy terms. Tracheostomy. We had this earlier in the respiratory system and in ear, nose and throat. Let's break it down. Tracheostomy. Ostomy is our opening, and trache was the trachea, your windpipe. So it's an opening into the windpipe. A big one, dacryocystorhinostomy. Let's break that down. Dakryo, break, cysto, break, rhine, break, ostomy. Dakryo, you cry tears, that's the clue for that one. So dakryocyst is the tear sac, and rhine is the nose, and ostomy is the opening. Well, what does this mean, therefore? Opening between the nose and the tear sac. In this case, ostomy is not bringing a tube to the skin surface, it's actually clearing a blocked passageway. Let's look at a diagram to help us explain. Here we have a diagram of the eye and the tear sac. The lacrimal gland makes the tears. The tears pour out over the eye. From the eye they then drain out towards the tear sac and then down towards the nose. If you have a blockage in your tear sac, the tears cannot drain away through the tear duct. So what needs to happen is a section of bone, which is here, is removed to make a passageway for the tears to drain across and down into the nose this way. And that is called a dacryocystorhinostomy. So it's actually making an opening between the nose and the tear sac. Our next term is esophagostomy. Ostomy is our opening, and esophag relates to the esophagus, so that would mean an opening into the esophagus, where the opening is brought to the skin surface. Our next term, esophagostomy. Let's break it down. Esophag relates to the esophagus, which is your gullet, so it's an opening into the gullet. And in this case, it's not clearing a blocked passageway, it would be bringing the gullet to the skin surface. Jejunostomy. Let's break it down. Your jejune relates to the jejunum, which is part of the small intestine, so that would be opening into the jejunum, the small intestine. Our last term on this slide is percutaneous endoscopic gastrostomy, also known as a PEG. Let's break these terms down. Percutaneous breaks down as per, cut, and then aneous. Cut actually means skin. Per means through. So it's through the skin. Endoscopic, well, that's looking inside. And gastrostomy, that's making our opening into the stomach. What actually occurs here is an opening into the stomach going through the skin, having done a visual examination inside. And this is known as a PEG. And this would be done for feeding purposes. Hopefully you feel more comfortable with your ostomy terms. Let's look at some general terms. Our first term on this slide, polyp. Polyp, you may remember, is a protruding growth. And we had polyps that occurred in the intestine. You can get nasal polyps, cervical polyps. A word example would be dysplasia of a polyp. This would mean when you have disordered formation or growth of a polyp. Benign means harmless or non-spreading, non-cancerous, it's not invasive. You have a benign tumour, so a mass or a lump that is present but not spreading. Malignant means dangerous, bad or invasive. You may think of the term malignant tumour, so that would relate to a cancer that can spread, it's invasive, it's dangerous. Another term where malignant is used, malignant hypertension, so that would be dangerously high blood pressure. Metastases, also known as METS for short, means secondary cancer. This relates to the fact that the disease has spread. So the term metastatic disease may be used to describe that a cancer has spread. Resection means removal of. So you could have resection of the colon or a colon resection, where they take away part of the colon. Stoma we know is our opening, and that the suffix ostomy relates to making an opening. Our word example, colostomy, it's an opening of the colon. It's time to recap some of our root terms. Let's recap some of these root terms. First of all, your gullet. Your gullet is your esophagus, or esophag would be the root term. A patient may have esophageal stenosis or an esophageal stricture, meaning narrowing of the gullet, in which case the food would find it hard to enter the stomach, and the root term for stomach, gastro. The stomach leads into the intestines, and the root word for intestines, enter. And the different parts of the small intestine include the duodenum, the jejunum, and the ileum. The root word for ileum is just ili. So you can have an ileostomy. The colon is your large bowel. Col is the root word for colon. At the beginning of the colon, you find the appendix dangling down there. It's part of your immune system. The sigmoid colon is the last part of the colon before it enters the rectum. And the rectum, proct. Your pancreas, where the insulin is made, is pancreat. Your spleen, where it stores red blood cells and recycles the bilirubin, is splen. Liver is hepat, and the bilirubin that the spleen has recycled gets sent off to the liver, which in turn turns it into bile, which is stored in the gallbladder, cholecyst. So do study these for a little while and make them stick in your head. Abbreviations. Our first abbreviation, GI, for gastrointestinal tract. GORD, G-O-R-D, relates to gastroesophageal reflux disease. Now the reflux is when you get the backflow of the acid going up from your stomach into your gullet. And you may remember that can cause problems with the bottom of your gullet, your esophagus, potentially causing narrowing, and then possibly something called Barrett's esophagus, which in turn could lead to nastier problems such as esophageal cancer. ERCP, endoscopic retrograde cholangiopancreatography. Graphy was our X-ray, and it was an X-ray of our pancreas and our gall vessels. DM was diabetes mellitus, and the two types that we have is type 1 diabetes mellitus and type 2 diabetes mellitus. GU stands for gastric ulcer. Many people get ulcers in their stomach or in their duodenum, DU standing for duodenal ulcer. What they discovered some years ago now was that these gastric ulcers, and in particular the duodenal ulcers, are caused by a bacteria, a bug, called Helicobacter pylori. This little chap here causes problems and can create ulcers in the stomach or the duodenum. With time they also discovered that they can get rid of this bug quite easily using a combination of something called a PPI, which is a proton pump inhibitor. It's a type of medicine which suppresses the acid in your stomach, and if you combine this proton pump inhibitor, this medicine, with an antibiotic to kill the bug, you not only get rid of the Helicobacter pylori, you also heal the ulcer at the same time. It's time to break some words down. Let's start off with proctocolectomy. Where are the breaks? Proctocolectomy. And that means removal of the colon and the rectum. Sigmoidoscopy. The break is where the oscopy is, so it's a visual examination with a lighted instrument to look at the sigmoid colon. Up the rectum, turn right. Esophageal stricture. Esophageal, well, the AL is relating to, and stricture means narrowing, so it's narrowing relating to the gullet. Our next term, Adenopathy, let's break it down. Aden, break, break, pathy. Pathy means disease, and aden is a gland. So adenopathy is disease of a gland. Pancreatitis, let's break it down. Itis is inflammation of, so it's inflammation of the pancreas. Gastric atrophy. Gastric, so gastric is relating to the stomach, and atrophy was the term meaning no nourishment. And if a tissue has no nourishment, it's going to get smaller. So we think of the term atrophy as the word wasting. So it's wasting, no nourishment, relating to the stomach. Wasting or shrinking of the stomach. Our next term, ileostomy. Ostomy, we know, means opening, and ile relates to the ileum, the last part of the small intestine. So it's an opening into the ileum. Adenocarcinoma, let's put the brakes in. Aden or adeno, carcin, oma. Oma is the tumour or the swelling, carcin relates to cancer, and aden is gland. So we have a cancerous tumour of a gland. Laparoscopic cholecystectomy. Let's break it down. Laparoscopic. The lapar is the abdomen, oscopic is our visual examination. Cholecyst is the gallbladder, and ectomy, removal of, so it means removal of the gallbladder via abdominal keyhole surgery. So if you think laparoscopy is the keyhole surgery going through the abdomen. Cholelithiasis, let's break it down. Cholelithiasis. Chole relates to the gall or the gallbladder. Lith is a stone, and iasis is a term meaning condition or disorder. So I have a condition of having gallstones, or a gallstone condition. Our next term, hepatolithiasis. Let's break that down. Hepat, or hepato, is liver. Lith, we know, is stone, and iasis is our condition. So therefore, it's a condition of having liver stones. So stones can actually occur in many places in the body. Our next term, otolithiasis. Otto, break, lith, break, iasis. You may remember that my ears are ot. So ot is ear. So therefore, we have a condition of having ear stones. Proctalgia. Oh, this is a funny word. Let's break it down. Proct, break, algia. Algia means pain, so proctalgia is a pain in the rectum. And lastly, neoplasia. Let's break it down. Neo is new, plasia is our formation or growth. So neoplasia or neoplasm would relate to new growth, new formation. Next we are going to remind ourselves of some of the prefixes, and then it will soon be quiz time. Let's revise a little bit more, looking at some prefixes and breaking down some words. A or an at the front of a word means no, or lack of, or unable to. So aphagia, no, phagia, swallowing. So it's unable to swallow. Aplasia, A is no, and plasia was our formation or growth. So aplasia implies no formation or a lack of formation, something isn't forming. Dys is difficulty, a patient may have dyspnea. Difficulty breathing, near was breathing. U at the front of a word means normal, so a patient may have some thyroid function tests and they come back as being euthyroid. They have a normal thyroid. Hyper is excess or raised, too much. LV hypertrophy. Well, hyper we know is the increased bit. LV related to the left ventricle of the heart. And trophy is our word where we think about nourishment or growth, but we want to think about it as size. So we have increased size of the left ventricle. Hypo, reduced, insufficient, not enough. Hypoglycemia, well, I'd have a blood condition of insufficient sugar, or insufficient sugar in the blood. Peri means around. Pericardial effusion. Effusion was the word meaning fluid, so here I would have fluid around the heart, in the pericardium. Hemi is half. Hemicolectomy. Removal of half of the colon. And that concludes this section, and it is quiz time. If you need to go back and revise, please do. We have some quizzes for you. If you go to the margin on the left-hand side, that will take you to the quiz section. See you for the next module.